Another area that we grapple with many times, and that there's much divisiveness within the eating disorder field, is whether or not these are curable diseases, whether or not these are chronic diseases, whether or not these are treatable diseases. And there, again, are people who believe, or treatment centers or treatment approaches, where I believe everybody has a curable eating disorder, or everybody can recover from their eating disorder. And we know from the epidemiological research that about 20, maybe 30% of our patients will struggle with their eating disorder in a chronic way, sometimes in a relapsing or remitting pattern. So our research tells us, 20%, maybe 30% of patients will have an eating disorder, and it's a chronic illness. We also know that we have plenty of patients who are cured of their eating disorder, who are treated, get treatment early, get adequate doses of treatment and expert treatment, and they're able to recover and never have a recurrence of their eating disorder for the rest of their lives. And I really do believe that when we treat patients with eating disorders, we don't yet have a good way to identify those patients who have chronic disease and those patients who have a curable disease. I think intuitively as clinicians, we understand this. And I also think as clinicians, none of us want to be in a position where we're misdiagnosing somebody as having a chronic illness that actually has a curable illness. And I think all of us have met patients who've been told by people in the field, you're never going to recover from this, or you've been through 7 treatments, this is something you're just going to have to live with. And lo and behold, in a different treatment approach, this patient does recover. So a lot of that, I think, depends on who's treating the patient, which patient we're treating, and also once we get more tools in our toolbox to identify what types of illnesses we actually are treating, both within a specific diagnosis and across diagnoses, this will become less of an issue. But we're a long ways from that.